The reason I chose my residency is because I appreciated the two sides of academic and community medicine that we get to do. We are associated with the university. It's workshops that we get to do. We get to collaborate across the university programs. I've been working on a pediatric lifestyle, which is for patients with pediatric obesity. So I've created a standard work and gotten to collaborate with other residents and other programs. We get to engage with the community in a great way. We're ingrained in the community. We get to work with community partners often through things that are locally done. After the murder of George Floyd, we were involved in a supply drive that took place in our parking lot. This was a great way that we got to engage with the community and help provide services. So we had basic medical supplies and some food, and then combined that with community partners who were helping to supply the area of North Minneapolis. And this was an important thing to us because of the riots and the looting that happened afterwards. A lot of our patients were unable to access grocery stores or pharmacies for those little things such as diapers and Band-Aids. And these are all little things that seem like small but can have a big impact on lives. So getting to work with the community and provide that was a great opportunity that we really enjoyed.
I chose this program for a number of reasons, but one I was pleasantly surprised to find was how much I enjoyed working with our Suboxone patients. We have quite a strong addiction medicine program at Broadway, having a couple faculty who are quite experienced in this regard. I found that this is a great way to kind of bring young adults and middle-aged adults back into the fold of primary care where they wouldn't often otherwise be accessing the healthcare system.
See, many of our faculty members are really involved in the Minnesota Academy of Family Physicians, and as a resident I've had a lot of opportunities to get involved in the Minnesota Academy of Family Physicians myself. One of the things that I got to do was testify in front of the state legislature in regards to an insulin affordability bill that actually ended up passing our House and Senate and is now on its way to providing a lot of affordable insulin for all the citizens of Minnesota. And that opportunity was only available due to my involvement with this residency program.
I met with residents across the university that were also interested in leadership, so we gained skills and got to learn how to apply those skills to both our residency now, but then our future careers. And through that, I was able to get involved in some committees across the university, which has been a great opportunity to develop my skills as an academic professional. I've gotten to develop curriculum for residents as teachers because teaching is such an important part of our residency. We love having med students, and being able to teach them well is important to us.
The program is our commitment to social justice and centering care at the margins. I think all of the residents and faculty share that sentiment and really bolster each other along that journey.
I was really happy to have a lot of the procedural opportunities that I've had here to really gain skills not only within the clinic, doing full spectrum procedural and opportunities for my patients who may otherwise have barriers to some of that care, but also in the hospital and doing some of those advanced procedures, not only with our family medicine faculty, but with the emergency room and anesthesia providers who've helped me to gain competency in central line placement, arterial lines, paracentesis, thoracenteses, and just having the support to really explore that opportunity within the hospital and feel that I can bring some of these skills out to my patients and have some of that fulfilling practice of true full spectrum family medicine. So.
We have faculty who are world-renowned in many different fields, including advocacy, addiction medicine, and their varied interests were a big draw for me, and I've been so lucky to learn from them and to continue to learn from them.
We work with a lot of community doctors in the hospital. We get to see different sides of medicine. We talk about the art of medicine, and so we get to see community preceptors who teach us kind of some of the differences in how to handle things. We get to work with other family med docs who come in and do deliveries on labor and delivery. That's a great opportunity to get to know some of them, but also to see the way that prenatal care is handled with different populations.
I wanted to come to the North Memorial program because I wanted to learn with and from both residents and faculty who are passionate about family medicine. I wanted to gain skills in advocacy. I wanted strong inpatient training. I wanted to be a part of intentional community partnerships. I wanted to engage in difficult conversations about power, privilege, and health disparities. And I wanted to be a part of a team who really care about our patients and one another. I found all of these things at North Memorial.